All right, sir, we are live now.
I just seeing my image. I don't see anything else.
It's all right,
Is there-
sir.
So I hear nothing of the meeting.
All right, sir, we are live now.
Okay, but I'm not seeing the presentation.
Sir, please wait, and YouTube is a little slow. It comes a little after what we say.
No problem. Nothing of the meeting.
Yes, sir. You won't be able to hear the meeting itself from the YouTube. You will hear it from us, from Zoom.
But I'm not seeing the presentation.
Please wait, sir. Sir, please wait.
I don't know. It's repeating. It's repeating what you've already recorded that. That wasn't me speaking live. So I don't know.
So I think you are seeing both the things parallel, like you are having a YouTube channel also and Zoom meeting also. So I think you should close one app.
Okay,
Please
okay.
close the YouTube.
YouTube, please close the YouTube
Okay.
app so that we can join only on Zoom. It's for audience, the YouTube app.
So I don't know.
So I think you are seeing both the things parallel, like.
I only have the Zoom open now. I don't hear or see it. I only see my image. Hello, can you hear me?
Yes, sir. Sir, we are starting now.
Okay. Tell me when I should start being able to see it.
Yes, sir. Hubabai, please share the screen.
I don't hear any. I don't hear anything or see anything.
Can you see me, sir?
I can see the Merenkov AIDS Society screen, but I do not hear anything.
Sir, can you hear me?
I can hear you, but I don't hear what's. If there's something going on at the meeting, I don't hear it. I just see a.
Sir, don't worry. Don't worry. It's all right. Okay. Assalamu alaikum, everyone. My name is Haris Mumtaz Malik, third year MBBS, Rawalpindi Medical University. Also, the publication and computer section sub in charge of Medical Aid Society. First of all, I would like to invite Mr. Ahmad Haroon, fourth year MBBS finance section in charge Medical Aid Society, for recitation of Holy Quran.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم والضحى والليل إذا سجى ما ودعك ربك وما قلى وللآخرة خير لك من الأولى ولسوف يعطيك ربك فترضاه ألم يجدك يتيما فآوى ووجدك ضالا فهدى ووجدك عائلا فأغنى اليتيم فلا تقهر وأما السائل فلا تنهر وأما بنعمة ربك فحدث صدق الله العظيم.
Thank you for the soulful recitation, Mr. Ahmed Haroon. Next, I would like to request the President of Medico Zeyd Society, Dr. Shahrukh Ahmed Khan, final year MBBS, to come forward and give a brief introduction of Medico Zeyd Society.
Assalamu alaikum. Am I audible?
Yes, sir, you're audible.
Assalamu alaikum, everyone. Shahrukh Ahmed Khan here, final year MBBS student from Rawalpindi Medical University. I'm currently working as a president of Medico Aid Society. First of all, I welcome our worthy guest speaker, Dr. Zeyd, and all the participants to our webinar on World Blood Donor Day. Before starting webinar, I would like to introduce Medico Aid Society to all of you. Medico Aid Society is a registered society, non-political, non-profitable, totally student-based welfare organization registered with Social Welfare Department of Baitul Mal and Government of Punjab. We are volunteer organization established in 1983, and we were established for the working of blood section, especially blood work for the providing blood donors to emergency cases and for the thalassemia patients. Our patron in chief is our worthy Vice Chancellor, Professor Dr. Muhammad Umar. And our staff in charge is Dr. Jawad Zeyd, who is current head of Department of Anesthesia, Holy Family Hospital. This is our panel, panel 2022 to 2023. Medico Aid Society is currently working with its 4 major sections: blood section, medicine section, finance section, and publication section, which are collaborated and conjoined by a general section. First of all, I would like you to introduce blood section. Blood section is our most energetic and the bubbling section. This section was a thing on which Medico Aid Society was founded back in 1983. We work in main 2 domains. First, for the thalassemia patients. For that, we organized different blood camps in different institutes of Rawalpindi and Islamabad and in some of the peripheries. And the second main working of our blood section is providing emergency and providing fresh donors to deserving and needy patients who need blood in emergency cases in hospitals of twin cities, Rawalpindi and Islamabad. Medico Aid Society has arranged more than 20,000 bags in 346 camps till now. And these are some of our camps from year 2022, in which we have organized camp in Islamic University, 2-day camp, and collected 206 bags. Zabis University, Air University, and JSF Center in NCS, and again in JSF Center. Total at 6 blood camps, we collected 639 blood bags, which were used for thalassemia patients. And we also conducted 3 donor drives, in which our girls participated enthusiastically, and in which 28 girls donated blood. Fresh donors which were sent from RMU in different hospitals in the twin cities in 2022 were 252. Total blood bag collected were 919 back in 2022. Blood camps in 2023 are till now. We have conducted blood in NSU, National Skill University, on 17th March, in which 53 blood bags were collected. Then Vati Medical College, in where 80 blood bags were collected, and Jamia Rizvia Ziaul Ulum, in which 60 blood bags were collected. Total blood bags in 3 camps are 193. And a 1 donor drive was conducted, in which 8 girls donated blood, and arranged and fresh donors that were arranged from RMU were 113 till now in 2023. Total blood bags in 2023 are 314 till now. These are some of the highlights from our blood camps. Now come to our medicine section. Medicine section is the one that deals with medical camps in peripheries of Pindi, Islamabad, and organize vaccination camps and deal and handle the dispensary which is in our office in Medicos Aid Society, Rawalpindi Medical University, and also deals the some medicine boxes which are in different hostels, our 4 main hostels of Rawalpindi Medical University. Next slide. And these are some of the stats from our medicine section. Next slide. Next. These are some of the medical camps in 2022. These are the some of the highlights of our medical camps. And these are the pictures from our vaccination camps. Coming to our finance section. Finance section is the backbone of our society, which
Okay, so this is our finance section. It is the root of MS. All branches of this, it is like a tree, and like blood section, medicine section, computer section, publication section depends upon the roots for their nutrition and growth. In short, finance section is the foundation of building of MS. Next slide, please. So, Haris, next slide.
it was some network error. Haris, kindly share some screen for the slide.
Going to try. Tell me when I should start sharing my screen. I don't hear anything.
Sir, just wait. Let me complete the introduction. So then you,
Okay, I'm
you can
sorry.
start.
Okay, no problem. I don't
Sir.
hear, I'm not hearing it or seeing it right now.
Just there was a little glitch.
Okay,
So
I'm
No
sharing
problem,
the
no
screen.
problem.
I'm
Okay.
sharing the screen. Shah Rukh Khan bhai. Is it visible? Is it visible?
Go to the finance section. Yes, go to the finance section and end of this slide. End of finance section.
Okay, I'm going. Is it now visible? Dr. Shah Rukh?
Next slide. And these are the activities that were conducted and the expenditure. And this is the photos of our drive, Russian drive we conducted in the flood. Coming to our publication and computer section, that shows and publicizes all our activities and is also conducting a webinar right now. It connects our society with the masses. It is and all the awareness topics. Next slide. This is the general working and some of the highlights. We also conducted the first ever podcast by MAS and our national level competition for the fundraising competition and during the flood. And publication section also make monthly and monthly reports and annual reports, post videos and posters on social media on different topics, health related topics for the general public awareness. These are our social media handles that are handled by our publication and computer section. And this is the picture of our the board that is maintained, a software that is maintained by publication section. And coming to our general secretary, joint secretary, and presidential panel. It maintains the section and coordinates with them. And our connections with university administration, social welfare department, and Baitul Mal. Thank you, everyone. And this is the official contact number of our society. You can note it, and in any case, you can contact with our official number. Over to you, Haris.
Shall I start to share my screen or wait? You'll tell me.
Okay, so he is a graduate of Northwestern University Honors Medical Program, BS and MD degrees. He's a board certified in anatomic and clinic pathology by American Board of Pathology. He's a fellow College of American Pathologists and fellow American Society for Clinical Pathology. So I would welcome Dr. Zeyd to present on this World Donors Day. He has made a presentation for all of us, and over to you, Dr. Zeyd.
Okay. Bismillahirrahmanirrahim. I want to thank the Merenkov Aid Society and Rawalpindi Medical University for giving me this opportunity to talk to you and share my comments and thoughts about this great day, World Blood Donor Day. So let's start our meeting. If anyone knows where this is taken, I'll be surprised. Anyway, this is my lecture today is for a general audience and going to explain the process of blood donation, who should not, what happens after we collect the blood, and a little bit of how we give it. It's not meant for a medical or technical or nursing audience. The dedication is to the blood donor staff and the hospital blood bank staff, and of course the donors, the heroes supporting our patients and saving lives. Without blood, there can be no hospitals. There can be no medical care. Having sufficient blood of the appropriate types and compatible for your patient is essential for the whole healthcare system. If there's just one set of questions to remember from my lecture, it's this. The questions that we must answer in this process is it safe for the donor to donate? Can the donor give up to 10% of his blood volume without any medical risk? Secondly, even if he can give the blood, is that blood suitable for a patient? And in that case, of course, we're especially looking to minimize disease transmission and any reaction from any medications that might be might have been in the donor's blood and now are in the blood bag. So, there are 4 main elements in blood. Red blood cells provide hemoglobin, which provide oxygen so that you can respire, so that you can get your energy, and that's why we live. Plasma provides factors for clotting and carries a lot of other substances in the blood, which are essential. Platelets help clot the blood. They're the cellular clotting factor, and they work with the soluble factors. The white blood cells fight infection and give one type of immunity, or they produce antibodies indirectly. So these are red cells after they've been, the red cells are made from whole blood. We get plasma, platelets, and red cells. These are separated red cells. In process, they don't have a final blood bank label. The color you can see is sort of dark red or a little bit purplish. This is plasma that's in process, so it doesn't have a final label. And this plasma was processed by it was collected from a machine called apheresis machine. So this collected roughly 300 ml of plasma. And these are platelets, which were separated off the whole blood. And these will be combined. 3 or 4 of these will be combined together to make a unit of platelets for treatment for an adult. Blood is a drug. It's a drug that every hospital, blood bank, or donor center makes. It can only be dispensed by the physician. It can be used to treat blood loss, or in the case of defective hemoglobins like sickle cell or thalassemia, it can be used to replace this abnormal hemoglobin. Blood provides the blood clotting factors and platelets, and it also provides immunoglobulins that fight infection and increase immunity. We can take the plasma and separate it into many, many fractions, and these can be given to treat a variety of illnesses. Again, the question is, when the donor walks in the door and he's going to be questioned, we'll go over the process. The first thing is does the donor feel well? If you want to donate blood, but you don't feel well that day, do not donate. You don't know what you have. You may have nothing, but you could be coming down with an illness. And many, many things when they start illnesses, you cannot tell what you're going to get. It's very non-specific. So I cannot emphasize enough. The first question we ask the donor, are you feeling well? I never try to push a donor to give blood if he isn't feeling well. Now, one of the other things, there's a lot of reasons why people are disqualified from donation. And here's some of the common things. You have to eat and drink something within 2 to 3 hours before the donation. If you don't, you should not donate. You should go eat and drink something and then come back. And if you eat something, don't eat something very fatty, because this makes your plasma look white, and then this can interfere with the processing of the blood. Next, do not smoke before and don't smoke immediately after donating. If you do, you have run the risk of fainting. Now, it's summer where you are, it's winter where I am here in Mauritius, but in summer, you lose a lot of body fluid at the high temperatures. So you may even need to drink extra fluid before you start the donation, because I'll tell you, you could sweat a half liter of fluid in 10 to 15 minutes. The other thing is, when you come to the donation, be prepared to give your medical history. Do you have any diseases of the heart, the lungs, the joints, anything? And your list of medications. Why? Because some of these medications may indicate that you should not donate, like if you're having you're getting antibiotics for an infection. That in the bacteria or whatever the infecting agent can go into the blood unit, and that can infect the patient. Also, some of these medications make it not suitable for you to donate. Your body knows how to react after giving up the blood, but some medications blunt or stop this adjustment, and so you could feel faint. The last thing is the travel history. We always think about malaria, but there's lots of other diseases. Like where I am now in Mauritius, we have chikungunya. I don't know if you've had chikungunya in Pakistan, but this is a common infection. And if you've been traveling to Mauritius for the last 2 to 4 weeks, you probably should not donate blood. Same if you've been in an area with dengue. There's lots of travel restrictions, and your blood center will know how to handle that. How much can you donate? Well, this varies by country's rules, but here are some general rules. Every 8 weeks, you can donate a unit of whole blood. It'll take your body 3 to 4 weeks to restore the elements. Your blood volume will go up, but to replace the cellular cells, the red cells, the white cells, the plasma, this takes longer. So normally donation is only every 56 days. There are some exceptions, but in general, you should assume you can come every 2 months. Apheresis, there's a machine, we'll show a picture of it. You can donate twice a week, 2 days minimum apart, maximum 24 hours. Okay. And if you are a really, really good blood donor and you donate frequently, you may need to take some iron, and the blood donor center will advise you of that. So now we're going to talk about the actual process of donation. This is my friend. He is not allowed to collect donor blood, but he just likes to look at it. Anyway, blood donation, the steps. You come into the area where they're donating, you have to register yourself. You have to provide an ID with a picture so we can positively identify you. Why? Because if we do some testing and we find some abnormal results, we want to contact you and counsel you so that you can get the appropriate treatment. Registration is important because it's required that we know the identity of every single donor. After registration, or in the registration, we often check for donors if they've been deferred before. Sometimes you are deferred from donation for a particular time interval, days or weeks or sometimes months, and we check and see if that actually is the case. That's usually done by a computer, but it can be done manually. Once you finish that process, the next is you go to a private area and you ask the donor a series of questions. This will be defined by your country. I'm not going to go into details of it, but we're going to do some checks. We want to know if it's safe for you to donate, and we want to know if there's any problem with the blood that might mean we could not use it. Example, if you take certain medications and it goes into the patient, this might not be good for the patient, especially if the patient is pregnant, because then those medications can go into the fetus, the baby, and cause problems. So we have a detailed question. It's done in private. No one's going to hear what you're saying. Then we have a physical examination. We check your blood pressure, your pulse, your temperature, and respiratory rate. And we also check your arms to make certain there's a suitable vein. Some people do not have big veins or have scarring at their vein in the area where we collect, and we cannot collect. Then we have the collection process, and it depends what we're collecting. For whole blood, up to 10 to 15 minutes. And for the pheresis, it could be up to an hour and a half. And post-donation, we observe you, we give you something to eat and drink. We also make certain that you're feeling all right after the donation. We're very interested in keeping the donors safe. We don't want you to have a reaction. If you get a reaction from donating, you're probably not going to want to donate again. And we don't want that. We want people to repeatedly donate blood. So here's a picture from Australia in Sydney. And here is the registration desk. You have several people which check your ID and check in the computer system, and they generate labels and paperwork for the donation. Then you have a private room, and we ask a series of questions, including the medical history, medication history, and travel history. Donor physical exam be done in that same area like here, and we check your blood pressure, pulse, your breathing rate, and your temperature, and we look for any lesions on the skin. If you have an infection on your skin, we don't want you to donate because that infection, the bacteria in that can go into the blood, and that can cause problems for the patient. Anyway, if you have scarred veins, we probably can't collect that way. So the collection process itself, there's two types: whole blood, usually 450 ml, which is less than 10% of the total blood volume. And then there's a machine, an apheresis machine, which separates the blood. We only take one part. We take the platelets, the plasma, the red cells, or a combination of them. And rarely we can collect white cells for certain types of infection. Here's an example of blood donation from Saudi Arabia. And in Saudi Arabia, the troop, what we say Arabic, Fariq, comes to the donation campaign. The captain here has to donate blood and set a good example for his soldiers. So here's someone doing the phlebotomy. Here's a pheresis machine. Pheresis machine, the patient's is also, we also put a needle in, and the machine will collect what we desire, usually platelets or plasma, but it could be red cells or a combination of any of those. Now, your arms are not sterile. They have bacteria on them. Some of those bacteria can grow in the blood, and that causes problems. So we have to clean the arm well. We disinfect it. We use special solutions. Actually, normally we use two solutions, one of which is yellow. It's an iodine-based solution. And then our staff will insert the needle into a large vein. And we use experienced people because we don't want to damage your vein. And I said the collection time varies by what we're doing. With that needle, we can either go on the apheresis machine or we can do the whole blood. After the donation is done, you go to another area where you're going to be observed. Here in Australia, they even offered sandwiches and drinks to the donors, and they're being observed. They stay usually for at least 15 minutes. And in Australia, they're very, very keen to get you to come back to donate. So they have an appointment desk where they make you an appointment for your next donation. So these are different ways of handling the situation, because if we don't have the blood, we can't do the surgeries, we can't handle the traumas, the car accidents, etc. Now, when the blood is collected, we collect the unit of blood and we collect some specimen tubes. In the laboratories of the donor center, we test for some infectious diseases: hepatitis B, hepatitis C, HIV, which is the infection with the virus that causes AIDS, malaria. Some other regions may add additional tests, hepatitis E and others. HTLV is another virus that they check for. They may even check for other viruses like cytomegalovirus, CMV. Anyway, that's done in one area. Another part, they take the blood and they separate it, the whole blood, into at least red cells, plasma, and platelets. Now, in the specimens, They have to do the blood typing, and they check to see if the patient, the donor has any antibodies. Does the donor have any antibodies against the red cells? Because this is a problem. And in patients, especially sickle cell and thalassemics, they tend to make red cell antibodies. So it becomes more complicated to find the right blood. Now, the donation processing area is very, very busy. Here is one afternoon in that area. They've got units of blood all over. People are doing extraction and other things. So these are very, very busy people. They're under a lot of stress. Here is equipment that's used for what's called nucleic acid testing. This does the HIV, the hepatitis B, and the HCV. You can do other markers other tests as well. Those tests are the most expensive tests that have to be done on the donation. And this is an instrument to do blood typing automatically. It's from Ortho. Now in your country, Ortho is introducing the hematology analyzers. And this way, we have large numbers of donors. We need to have an automated way of doing it to get through. Now, safety of blood donation. People are afraid. Often they think that they can catch a disease by donating blood. Back in the 1980s, people thought that they could catch AIDS, HIV, from a blood donation. This is entirely false. The donation area is clean between the donors, the chairs, everything. And we use disposable blood bag kits and needles. Nothing is reused. And we're also checking, we've already checked with the screening, the questionnaire and the registration time to see if the donor has any medical condition, which means that he should not donate. You do not catch a disease from the blood donation. Sadly, you can't store blood for a year. You can't have it like UHT milk and it's valid for 15 months or whatever. Blood is short-lived. Whole blood, if it's available, is only 3 weeks. Red cells, it depends on what solution you put them in. It's either 5 weeks or 6 weeks. And platelets, depending on how they're stored, can be 5 days up to 14 days if they're refrigerated. Blood types. Unfortunately, I don't have the exact numbers for your country, but when I was in Qatar, among some of the foreign, the group B was somewhere close to 20%. So in Europe, there's much less group B than there is as you go further east. And people of Indian extraction tend to have greater group B. That's also common as you go far east, like in the Philippines and Southeast Asia and that, okay? As you see, the largest group actually is often O in some countries. The A is usually maybe only 30% in other countries, and there's a group AB, which is a minority. Now, it becomes more complicated because you have to match or give a compatible blood red cell type to your patient. What you choose depends if you use the whole blood or the packed cells. So I use RBCs for packed cells. Whole blood, A gets A, B gets B, O gets O, AB gets AB. No exception. But if you use the red cells, you can use group O and give it to everyone, and then A gets A or O, B gets B or O, AB can get any type, and group O can only get group O. That's the red cells. But the plasma is different. Group A plasma, a group A patient can get A or AB plasma, BB or AB, etc., as shown on this screen. We're very severely short of AB plasma. It's the only plasma that you can give to everyone. Now, there are newer blood components. I don't know if they're yet available in your country, but there's a way to use Group O whole blood for everyone. But the patients, the donors have to be tested, that they don't have many antibodies against the ABO blood system. And this is used in trauma and very highly effective because it has plasma, platelets, and red cells all together, and it's fresh. So it's very good for trauma. Then, because of the shortage of group AB plasma, we can take A plasma and check for certain units which lack anti-B. I'll then go into that. Anyway, the most important thing in blood bank is positive patient, positive donor identification. You have to have a way of really knowing who gave the blood or the specimens and who is going to receive it. If you make a mistake in that, you can kill someone. We positively identify the donor at the time of collection. One staff member collects from only one donor at a time. They don't try to collect from multiple ones. And patients are positively identified when we collect specimens for testing to determine what blood they should get. And finally, at the time of the actual transfusion, the patients are re-identified and we check that the proper blood has been reserved or allocated for that patient. Here is a hospital blood bank. This is one in Saudi Arabia, and they have lots of workstations and they do lots and lots of testing. Hospital blood banks, not all of them have this much room. Anyway, in the hospital blood bank, they have to repeat the type of the patient. They don't rely on what's on a driver's license or in a passport. They must have a specimen that they can type. And there are many other blood groups. There's over 300 different types of blood. And some of these may need to be matched in certain patients, especially the so-called Rh factor or the first Rh antigen 1, which is called big D. And so that may be done in selected patients. They check for antibodies against red cells. This is extremely important for your sickle and thalassemia patients. 30 to 50% will make these antibodies, which can be very clinically significant and make it very hard to find compatible blood. If you don't match it, you might kill the patient. And then we do a last test. We test donor plasma for antibodies against the patient's red cells. That's called a cross match. So red cell antibodies, over 300 red cell antigens or proteins or sugar on the surface. Some of these may cause an antibody to be produced. This can cause destruction of red cells and cause life-threatening reactions. Certain antibody specifications must be matched before transfusion. Blood reservation. We hold a unit of blood from the time we match it for a patient up to 3 days. We also put a reservation label saying that this unit number, this blood type, expiring on this particular date, we give it for a particular patient name and their hospital number. The actual transfusion process, the doctor orders the blood. Compatible blood is selected in the blood bank. The reserved blood is taken to the patient's bedside. 2 people verify the patient identity. Why 2 people? Because it's so important that we want to double check that we're giving the right patient the blood. And they also check that the unit is the right type and has been reserved for that patient. And during the transfusion, the patient is monitored at the beginning, during, and after it. Now, donation myths. There is a shortage of blood components and demand is increasing. We don't have enough blood donors. Surgeries are canceled. Some patients die because there's no blood. It's important that we increase the amount of blood donation. Blood donation does not take a lot of time, 45 to 60 minutes for whole blood, 90 minutes for most apheresis. And again, there's no disease transmission risk. Blood donation is only minimally painful since we use experienced people and special needles that are selected to minimize pain. Blood donation only removes a small amount of your blood. And in general, you can resume most normal activities shortly after completing it, but don't smoke. Shouldn't be smoking anyway, but don't smoke after blood donation. So, this is the summary. Blood donation is a complicated process to ensure the safety for the blood donor and the intended patient. It requires a dedicated team of blood bank personnel in the blood donor center and the hospital blood bank or transfusion service. There are many repeat checks to identify the donor and the patient and the testing to make certain that the right blood goes to the right patient. And the most important thing, unless you donate, nothing can happen. There is no hospital. And if you do not donate, you're going to have problems with covering traumas and accidents, surgeries, and for those patients with the hemoglobinopathies, the abnormal hemoglobins, like thalassemia and sickle cell. So we need a lot of blood donations. It's simple, it's safe, it's one of the best sadaqah so that you can give your fellow man. So, final comments. Respect your blood bank staff and physicians. They're under great stress. When there's trauma or a lot of surgeries, they're very, very, very busy. Don't waste blood and don't do this. Here is the angry surgeon who's upset with the blood bank physician. So again, I appreciation for the Merenkov Aid Society of Rawalpindi Medical University, blood bankers around the world, and my teachers and mentors during my career. And that's my final slide. That's the slide looking out at the west coast of Mauritius. You see the reef at the edge. Beyond it, the water is dark blue, and that's the southern winter Indian Ocean. Thank you for your time and your patience. Assalamu alaikum.
Assalamu alaikum, sir. Sir, there are a few questions from the audience. Would you like to answer them?
I'd be glad to try.
Okay. So, sir, some people say that blood donations lead to weight gain. So, what's the truth in it?
There is no truth to it. There are no studies, there are no studies that have shown that there's any weight gain. And I'm saying is that actually by donating regularly, you stimulate your bone marrow, which produces the cells, to be more regular, and actually people feel better. There is no medical evidence for weight gain, unless afterwards you're eating a lot of samosas and jalebis and ladus in the post-donation area. But aside from that, there is no way you would have weight gain.
Okay. So, the next question is, do people faint just because of the fear of donating blood? What's the reason for a person feeling dizzy and going pale suddenly after donation?
Well, some people have a reaction. They're very nervous. And guess what? Who does this more, males or females? It's males. Males think they're not supposed to be afraid or anxious. So they want to show that they're not anxious. But when they donate blood, this anxiety can cause a reaction called a faint vasovagal reaction, which is entirely harmless. If you lie them flat, it goes away immediately. It's a stress reaction. Not everyone has it, but a lot of people do have it. And I'll tell you, I found it most common among military. Military men donating blood, a group of men, they can all faint at the same time. And it's nothing to do with the process it's the individual. We have to reassure them it's a safe process. And we also keep them for some minutes afterwards to make certain that they're not going to faint. And also when they're in the blood bank, they can't smoke. I tell you, smoking is not good. Should not smoke at all, but don't smoke just before a blood donation, and definitely not within an hour or two after donation.
So, sir, if someone faints after blood donation, then what is the protocol of recovery, and for how much time should we lie down after the donation of blood?
Okay, so the blood bank the blood donor center has a series of protocols or procedures for different types of reactions. The fainting one is the most common. And if you lie them, what happens is that there's a nerve called the vagus nerve, and this lowers the heart rate. So there's not enough blood when they stand up, so then they feel faint or could black out. If you put them flat, it goes away. They're not gonna be unconscious. They'll immediately resume they'll feel a little fine. Sometimes they can even vomit, but that's very, very rare. And then what we do is we take their blood pressure. We make certain that their blood pressure recovers. We take their blood pressure while they're flat. Then we sit them up in the chair and we take it again and make certain that it's stable. Also, we don't let them leave the blood bank. We hold them. We wait maybe 15, 20 minutes, check their blood pressure again, that it's normal, make certain they eat and drink something, and they go. So it's very rare. You don't see a person that has to be sent to trauma or casualty because of a fainting episode from blood.
Okay. And sir, if blood has been screened and groups are matched, can there still be contraindication for transfusion?
Well, there's lots of contraindications for transfusion. That's a very complicated story. And unfortunately, this was supposed to be a general public lecture. What I'm saying is that one thing, the safest transfusion is no transfusion. If the patient can be treated without a blood transfusion, that's the safest thing. But there are times when you can't do that. Cancer chemotherapy patients, the sicklers and the thalassemics, and other conditions, they do need blood. Contraindications will be depending how you give the blood and which blood you give. I told you, the patient has antibodies against red cells, like an anti-little c or an anti-S or anti-Duffy A or B, these many different types that we have to match. The person makes anti-little c, we have to give them little c negative blood. We have to type the blood unit for these other antigens. So it'd be contraindicated to give blood that was not matched. There's so many conditions. But the most important thing is blood is not a tonic. You don't give it as a drink. You give it only when you need. The Quran says it's, you're not supposed to consume blood except, for certain extenuating circumstance. And blood transfusion is an extenuating circumstance, but you just don't give it. If you can give a patient iron pills, and if they can afford to wait, they can, and they had that this restores their blood, then that's a better way to do it than to give the blood transfusion. Every intervention has a risk. Every medication has plus and minus, and blood is a medication. Speaking very generally, but if there's not a specific condition or scenario that you want to give me, I can't. I really can't specify further.
No, sir, it's quite clear. So the next question is, can someone with previous history of blood cancer donate blood safely?
That is controversial. Normally, we do, in my blood banking systems and under the rules that I follow, we do not let them donate blood for other patients. We do let them collect blood for themselves. For example, it's called an autologous donation. If a person is going for, say, hip surgery, and we can collect that donor's blood and save it for himself or herself and give it to them back at the time of the surgery. We don't know all the causes of cancer. Some cancers may be caused by viruses. So no one really knows if you can transmit cancer by giving blood from a cancer patient. So generally, we do not collect. Also, most patients, their hemoglobin, the blood parameters that we use to determine if they're going to be suitable for donation, they don't restore back to like a normal person. So for that reason, they're also not allowed. So generally, the answer is no.
All right, sir. So, what is a mega unit, and is mega unit donation harder on the body than a blood donation?
Okay, you cannot, if you use the pheresis machine, I showed a picture of that, you can collect 2 units of red cells at one time. So in approximately 25, 30 minutes, you collect 2 units of blood, which are put in the appropriate solutions for use. Well, when you do that, you've lost more blood volume, but you're not taking out the plasma, so it's not the same as 2 units of whole blood. But that the person is probably going to be somewhat weak after that, and he should not resume his normal activities after that. He should take it easy for the rest of the day, drink plenty of fluids. Now, there's one thing we didn't really talk about, was about iron loss. The hemoglobin in the red cells, the most important thing is the iron, because the iron is where the oxygen is stored. It's bound to the iron. Well, with each unit of red cells or whole blood, 250 milligrams of iron is lost. That's not a lot for a normal person, but if you take 2 of those, that's more of a blood loss. These people may have to take extra iron. Also, females, while they're before, the females may have more blood loss from menstruation and things like that. And so their hemoglobin levels may be lower and they may have lower iron stores. So we monitor that and we will decide, we may offer the donor iron and to help that. So a mega, what I call it is a 2-unit red cell donation. It's not whole blood, it's 2 units of red cells. That's roughly 400 ml of fluid. A whole blood donation is 500, but the whole blood donation only has 200 ml of red cells in it. So you're taking double the number of units of red cells, and this could make you feel a little weak for a few days. So when do we do it? We do it when there's a rare blood type. You have a patient who's O negative, and the need for a patient, they might take the 2 units. But there's another thing. That donor, instead of only having to wait 8 weeks, he must wait double time, 16 weeks, before he can donate again.
All right, sir. Sir, there is another question. What are some good incentives that we can provide to blood donors to motivate them to donate blood, as blood donation seems daunting to most people?
Well, this is the whole thing. It depends on your country. Some countries, they don't allow you to give a gift that has a lot of value, because they want to encourage that people should be donating just for the gift. They shouldn't be donating for the prize. And I know in some countries like the United States, they used to have a limit of something only $1 is what you could, in presents, you could give the donor. I think the most important is the incentive that you try to make them feel how important this is to give the donation, encourage them to do it altruistically. They're doing this to help their fellow men. Some places give T-shirts. I've seen books. I've seen in some countries there are lottery tickets. There are football tickets. Sometimes someone donates something to the blood donor center, and then they then give it away to the blood donors. But people should not be donating for the incentive or the gift. They should be donating for the gift of life.
All right, sir. Sir, can one donate blood if one has an unhealthy diet like fast food or fat-rich foods?
Well, we'll find out about that when we measure your weight and we check your amount of your hemoglobin. Fast food is not good. Fast food is not balanced. You have your local foods, home foods are much better diet. Eating dals and lentils and rice, and you have you're blessed that you have many, many different types of vegetables that you can get. These are very healthy things. Going to a fast food chain, it's fried potato, it's a lot of meat, can be greasy, or it's fried chicken, and that's very greasy. This is not good. Your local kebabs that are grilled are much better because they're much lower in fat. So you'll have to check and see what has been the impact. How has that affected that person's health? We have to know if the person's been eating an unhealthy diet for years, maybe he got heart disease, then we won't let him donate. So we check if a person has a history of heart or lung disease, the transfusion physician is going to be asking more questions about the donor, and he may even tell the donor to go to his cardiologist, heart doctor, or his lung doctor, pulmonologist, and ask them, provide him some more information so he can decide whether or not he lets the person donate. We're very concerned about donor safety. We don't want to risk the donor. The last thing we want to do is the donor to get sick from a blood donation, and we particularly don't want him to have that while he's in the blood donor center. That doesn't help the other donors. It scares them away.
All right, sir. Sir, alternatively, a person on low carb diet, is he able to donate blood or not?
Well, if they're on the ketogenic diets and that, they have to check that his vital signs are stable. Sometimes on those diets, people don't drink enough water. We'll pretty much know things by looking at the blood pressure, the pulse, and seeing how they are that way. But these have great stress on the kidneys. The ketogenic diets, people like them, but they put a lot of stress on the kidneys. You have to drink a lot of fluid. And in blood donation, you give up 500 ml of fluid from the whole blood, or 400 from the red cell double donation. So you got to replace that fluid. Okay. So if those people are already short of fluid because of the diet, they'll have to drink more fluid. We'll just check to see what their blood pressure and pulse is at the time of the donation. Just one last thing I should say. If the person eats very fatty food, this fat is seen in the blood, in the plasma. The plasma can turn white. And this can interfere with our processing, our separation of the blood. So we tell people not to eat a fatty meal 3 to 4 hours before a blood donation. You should eat, but not something a lot of fat.
All right, sir. Sir, there's another question. Are the criteria for donation elevated in case of emergency?
Elevated or being changed in time of case? I don't understand. Elevated? What do they mean?
Yes, sir. Alleviated in case of
Oh,
emergency.
alleviate. I'm sorry. Okay, alleviate. What I'm saying is that the transfusion medical director in emergency situations, at least in some countries and with some accreditations, has the authority to change. Example, if I had a patient who has a very rare blood type, and I only have one donor that matches that type, and that patient needs blood periodically, the donor is supposed to wait 8 weeks before he donates. Maybe I'll let him donate early, but I'm going to check that it's safe. I'm going to check that his red cells are restored, his blood is returned to normal, and I might let him donate more frequently, but I'll probably give him some iron, okay, as a result, because he's losing iron from having frequent donations. So there are some exceptions, but those exceptions have to be approved by a transfusion physician. But there are some things you just cannot make a variance for. You cannot allow. If they've had certain diseases or taking antibiotics or something like that, you can't let them donate.
All right, sir. So what is platelet pheresis, and is platelet pheresis donation harder on the body than a blood donation?
Not really, because the blood volume for a pheresis donation is probably on the order of around 400 to 500 ml. If it's a smaller dose of platelets, it may only be 300. The thing is that what happens in that machine, the pheresis, the word apheresis means it separates the whole blood, and in the machine, there's a layer of plasma, there's a layer of red cells, there's a layer of platelets, there's even a layer of white cells. So the machine finds the layer that has the platelets and it collects that. This process is a little slower. Now, the patient's on a machine, and so we give him something to keep his blood non-clotting. The blood does not clot. A little bit of something called ACD, acid citrate dextrose solution. And this is an anticoagulant, so the blood flows smoothly through the machine. It takes maybe double time from the whole blood donation, but it is safe. There are many repeated plasma donor, plasma or platelet donors on that machine, and actually, in the places I've worked, maybe 60 to 70% of the donors for platelets or plasma or red cells off that pheresis machine are repeat donors. Okay. Normally, what I would say is that first time donating, I would probably tell you to donate a unit of whole blood and see how you react to that. If you're fine, then I would say come back, and if you want to do pheresis, we can do it for you. But it just takes a little bit more time.
All right, sir. So is it possible to suffer from anemia while donating multiple times blood?
Yes, that's why I said the anemia is from iron loss, because you give a 250 milligrams iron. That's a lot of iron. So you have to eat well. You have to eat something that has iron, and iron is often in meat. So you have to eat enough to replace that. Now, females have the issue of menstruation, and they're losing iron that way. So females tend to be more susceptible to anemia after blood donation than males. But we can easily control that by giving them supplemental iron. We give them extra iron to take. And giving them iron, then they can donate on a regular basis. But that's why the interval is 8 weeks, 56 days. So giving you some time to replenish what you gave, and by eating a good general diet, you'll have enough iron, and that'll allow everything to restore itself. But some people have a problem with this because they have other causes for blood loss, and then this would be affected by the blood donation.
Right, sir. So there's last but not the least, there's one question more. Can a person with low BMI can donate blood safely or not?
Low BMI or high. Low BMI means you're small. If they're fat, they have a high BMI. Both sides can donate. Both ends can donate if they meet the criteria. Normally, in most countries, they have to be 50 kilos or more. Okay. With people who are obese, they may have, with the fat in their arms, it may be more difficult to find a suitable vein. But on either end, very low or very high BMI, that by itself is usually not a problem.
All right, sir. Sir, can I donate blood if I have been recently vaccinated?
This is a very good question. There are two general categories of vaccine: live vaccines and dead vaccines. A live vaccine is that they grew an organism in the laboratory, and then they used the live organism. They treated it, but they kept it alive. So when it comes in, when they inject you with it, or you take it as a pill, or you take a little cup of liquid like polio vaccine used to be, that you get a small infection from that live vaccine, and then those type of the vaccines, live vaccines, there's either a 2 or 4 week donor deferral from those. Okay, so those type, you cannot donate immediately afterwards. Most vaccines nowadays don't use live material. Like the COVID vaccines were never live. Those, if the person feels all right after the donation, he's allowed to, after the inoculation, after he took the vaccine, he can donate. Okay, if he's feeling all right. Remember, I told you the most important question: does the donor feel well? If the donor does not feel well, I don't care what the reason is, I don't let them donate, because they're more likely to have a reaction, and they may have something that they could transmit to a patient.
Right, sir. So this was the last question, and thanks a lot, sir, for the wonderful webinar, and we are extremely grateful for your precious time. We would also like to invite you to Rawalpindi Medical University on your visit to Pakistan later this year, and we would be honored greatly and looking forward to having more sessions with you, sir. We would also like to thank our viewers for participating in this webinar, and we'll see you soon, inshallah.
Thank you
Thank
very
you so much,
much.
sir.
And I hope you have a very pleasant evening wherever you are. And please never forget to donate blood.
Thank you, sir.
Okay, bye-bye. Assalamu alaikum. Okay. So I don't know who is out there monitoring, but thank you for the opportunity to work with you. Inshallah, in August, I'll be coming and doing some projects with Shaukat Khanum in Lahore, and probably also in Karachi, and well, not Karachi yet, but for Peshawar. So